Morning, everyone. Thank you for being here. My name is Frederica Williams, and I'm the President and CEO of Whittier Street Health Center. Today's vaccination is very important. Whittier Street Health Center has had a long history of serving vulnerable communities, minorities, and people who have had challenges with racial and ethnic disparities in healthcare. When the pandemic broke in March, we knew, because this is what we've been doing for 85 years, we knew that the negative impact would be in the communities that we care about and the communities that we serve. So we've seen the high rates of mortality and morbidity rates. We've seen the economic impact. We've seen the social impact. And this is what we've done. So it was easy for us to pivot quickly and to be able to provide testing. But it wasn't only about testing. Because we have a long history with the community, they trust us. We have community partners, we have our faith-based partners, we work with corporations, we work with the government to make sure that resources are brought to our community. So when testing started, it took a while for our community to trust, because we know that as Black and brown people, we've historically been guinea pigs. But with Whittier at the forefront and pivoting and also educating, we saw that between April 13 to December, we tested almost 40,000 people. And we couldn't have done it without the partnership of our community leaders and our faith leaders. So as we started exploring the vaccination, we were excited, of course, that there was a vaccination. We again held focus groups to hear from the community, because it's not my place or the Whittier place to impose on people what they should or should not do. As people of color ourselves in leadership, we needed to feel comfortable with the science and feel comfortable that this was truly a cure that would help the community. And so we did our own due diligence before we went to the community, before we had our faith-based focus groups. But also, as much as we thought we knew a lot, these focus groups with our faith leaders and our community leaders and our patients and our community elders and the youth really taught us a lot. So out of that, we developed educational materials. The reason we're hosting today's vaccination is our key influencers are faith leaders. Our key influencers are community health centers like Whittier Street Health Center, who people trust. And so our faith leaders who are here with us today, our esteemed board chair, Reverend Pastor Bell, Reverend Culpepper, who's the senior pastor at the Pleasant Hill Baptist Church and the head of the COVID-19 faith-based Boston, that very distinguished group, Reverend Mahoney, Reverend Green, and Reverend Hicks. In addition to being faith leaders, they are also frontline workers. So people have asked us, how come the Black pastors are getting to take the vaccinations? Our pastors get to visit people in the hospital, they get to visit people in the nursing homes, in the prison, so we also need to protect them so that they can continue the mission of serving the people we care for. Secondly, just as all of us, including Dr. Wright, our medical director, was the first person to stand in line to take the vaccination, and we made sure that all of our frontline patient-facing staff were vaccinated. As soon as I could, I did, because we cannot ask our patients to take the vaccination if we don't trust them. So we've shared information about there are Black scientists that were involved in developing the Moderna, but they also need to see that there are pastors that look like them, that believe in the science and embrace the vaccination. That is the only way we'll be able to get more people interested. So all of our employees, almost all of them have been vaccinated. Now our black pastors, who are also frontline workers and key influencers, are being vaccinated, and I think we're off to a good start. So I want to thank all of you, Reverend Culpepper, Pastor Bell, Reverend Mahoney, and Reverend Dr. Bishop Green, for doing this very important step of removing barriers so that we can get more people educated. We will also take vaccination so people know this is safe, you trust in the science, you're advocating for us to all be vaccinated, because this is the only way we will come to an end to this pandemic, so people can reclaim their health, people can reclaim their economic health and their social health. We believe that this pandemic has created a lot of underlying conditions, health conditions, economic conditions, social conditions. So the sooner we remove the barriers, the better off we'll be. So Happy New Year, and thank you so much. I know you guys are all very busy, and I'm just excited and truly grateful that you've chosen Whittier Street Health Center as your healthcare and social services partner. So now it is my pleasure to welcome to the podium my boss, the pastor, Reverend Gerald Bell, who's the chair of the Whittier Street Board. Thank you.
Good morning, and thank you so much, Frederica, and good morning to each and every one of you. We have one of our esteemed community board members with us today, Miss Eva Clark, and we work on the board of directors to work with Whittier Street. We are so proud to be associated with this organization who served our community extremely well for these plus 85 years. One of the things that's so important to me is that when you call the pastors frontline workers, what we have failed to mention, and I'm so glad the incoming administration, Biden and Harris administration, paused briefly in their transition government to recognize the some 400,000 Americans and also millions of others all over the world who've lost their lives to this pandemic. And for us, it's not the size of the church, it's not the size of the family. What we've learned and what we've seen over these past few months is, regardless of race, creed, color, socio-economic background, this virus kills. And I know that our community and others like to think that to look at the conspiracy theories and the outliers of should I get tested, should I take the vaccine? But what we need to look at is the fact of the over 400,000 who've died. So many more. So we're here today to lead the way. And what I've shared with my churches and what I share with my community is I receive my health care here at Whittier Street Health Center. My primary care physician is here. I tell my parishioners, take the vaccine, ask your primary care physician, deal with your specific medical history, which is personal to you. Put your trust in your faith above. And that's what we're here to do. I thank you for the opportunity. We couldn't have done this without tremendous leadership of not only Ms. Frederica Williams, but her entire staff. And I'd like to give them a round of applause. Thank you so much.
Thank you, Pastor Bell. When I mentioned the community focus group, Miss Eva Clark, who is on our board, Attorney Eva Clark, who's on our board, titles, was critical. She was very helpful in that process. And in addition to being an attorney, what she does is she visits prisoners, and she also visits nursing homes. So again, another frontline worker who's there in the fight. Now I'd like to invite the head of the Black COVID Boston Task Force and the senior pastor of the Pleasant Hill Baptist Church, the good Reverend Miniard Culpepper.
Thank you, President Williams and Dr. Wright and all those that have been servicing us in the community. I want to thank the pastors that make up and have been working with the COVID-19 Clergy Committee of Boston. The Clergy-19 Committee, COVID Clergy Committee, is made up of about 25 pastors that came together in the beginning of COVID. And we focused on our churches in the beginning. How do we transition out of churches, having service online, having services in our churches online, bringing in specialists. And so I want to thank Reverend Mahoney and being technically an expert in helping us through that. Dr. Green, Reverend Bell, and the other members of the COVID-19 Clergy Committee. We've started focusing on the churches and how we can bring the ministry to our folks, not just in the church, but in the community. And then the question became, because we saw that our folks weren't getting tested. And everyone kept saying, well, folks don't want to get tested. Folks don't want to get tested. I called Reverend Bell, COVID-19 Clergy Committee member. He said, let's call for Deacon Williams over at Whittier Street. We called for Deacon and we did a conference call. And we decided that the pastors would come together, have a press conference with us getting tested right here at Whittier Street. We did the testing. The next step was to take the mobile vans to the churches. I think Reverend Green was probably the first church that had the mobile van and testing at his churches. And we scheduled all the churches to do testing at the churches. We did at Pleasant Hill, one day we did 250 tests on one day. That week, for Deacon, we did over 500 tests at the church with the mobile van, and we thank God for Deacon having the foresight to have those mobile vans to do the testing. I've been tested 10 times myself by Whittier Street, and every time I've come up negative, thank God. And so this morning, we've been praying about this vaccine. I don't come to this vaccine without having skepticism and questions, especially when you think about what happened with the Tuskegee experiment and the syphilis years ago, where black men were promised that they were getting free health care, and instead of getting free health care, they were performing a syphilis test on them. Many of them died as a result of that. And so as young boys, we understood and heard about that Tuskegee test. And I've been skeptical about taking this vaccine. And the first thing I had to do was go in prayer. Then there's a group of pastors around the country that decided they would come together. Reverend Butts from New York, Reverend Perkins from Detroit, Michigan, Al Sharpton is part of the group. And so the movement was, we need to get out front because our folks are skeptical about taking this. I said, I'm skeptical too. And I went into prayer. And my members were saying, Pastor, what are we going to do about this vaccine? I said, I'm in prayer. Everyone that asked me, some of the other ministers in the city got out front. They wanted to get out front. I said, I'm in prayer. I called Reverend Bell, we're in prayer. I called Reverend Green, we're in prayer. I called Reverend Mahoney, we're in prayer. I called Reverend Higgs. We were in prayer about moving forward. And then I started reading what Dr. Martin Luther King said. When Dr. King said, science investigates and religion interprets. And as I looked at what he said, we began to discuss strategies. Frederica called me and said, we're doing focus groups. I said, well, we're going to have a pastor focus group. And the amazing thing was, when we had that focus group, I still had not decided to take this vaccine. I was still saying, I'm not taking that vaccine, thinking again about Tuskegee. But when I sat with the pastors, we did a Zoom call with Frederica, these same pastors and a few others, there were 6, and Dr. Wright and Melissa. They answered all the questions that we had, and we had questions. We met and we had a conference call. We decided to go to our members and have our members give us questions that they had. So we had a great focus group. At the end of that focus group, I had decided for Dika I was going to take the vaccine because she made it clear that it was in the best interest of not only our congregations, but our community and our country. This morning I had prayer with Dr. Perkins from Detroit. He took the test this week. I talked to Reverend Butts in New York. He took the test. I talked to Reverend Alvin Love in Chicago. He took the test. Reverend Perkins, I'm in the car on the way here. He said, let's have prayer. We had prayer before I got out of that car with the pastor from Detroit. He said, everything's going to be all right. Just before I got out of the car, Clay Evans, that song came on, everything's going to be all right. I sat in the car and listened to that before I got out. And so I just thank for Dika for the leadership and the partnership and the strategy. Our strategy is still developing. We're even talking about how do we take the van to the churches to do vaccines at the churches. Because we know when our people see us take the vaccine, I had one of my senior members call me this morning and said, Pastor, well, I'm not taking it till you take it. And I said, well, I'm on my way now to get that Moderna shot. My trustee of the board called me, and she said, Pastor, let me have prayer. Because I told them I was in prayer. She prayed for me. So we're doing this with much prayer. But we're also doing it knowing that science investigates, like Dr. Martin Luther King, our leader, said, and religion interprets. And so we've interpreted what the scientists are saying. And when you think about what Martin Luther King said, that we can't wait. And when he wrote the book, Why We Can't wait because we're losing. And when you look at our community, even though there are only 25% of those that are affected with COVID, 33% are passing and dying. We're losing 33% of the deaths are our community. And so we don't have a choice to stand and take this test today and then tell our community and tell our people, like Reverend Clavin said, I got a feeling everything is going to be all right. And we've done this through much prayer. And I just thank the COVID-19 Clergy Committee for being so faithful and diligent to make sure that our community understands that we're doing this because we want to encourage them to do the same as we did. God bless y'all. Thank you for Dika.
Thank you. Thank you, Reverend Culpepper. The next person we'll have at the podium is Dr. Wright, will be the final speaker. He's our medical director, and he has a personal story that I'd let him share. But I also, as we promote this video, as much as we are doing this with our faith leaders, when we did the test with the faith leaders, we had people of faith and people of non-faith. We had Christians, we had Muslims, we had people from diverse backgrounds. So I'm hopeful that with this vaccination, while we also want to target the Christians, we want to target the non-believers, the believers in the community, because it's very important, especially with the history of experimentation and the Tuskegee. So I just wanted to make sure that the community far and wide knows that they are welcome. Reverend Dr. Wright.
Thank you so much, Ms. Williams. Thank you so much. And this is an exciting day. Thank you all for being here. Really appreciate Pastor Bell, Pastor Culpepper, Pastor Green, Pastor Mahoney. Ms. Clark, thank you for being here as well. As I was sitting and listening to all of you speak, it just reminded me of the fact that what we say and what we do has consequences, good and sometimes not so good. I don't have to get into that part of it, but certainly your being here is a wonderful thing for the community. What you do, what you say, our followers, the people we take care of, our patients, they will be influenced by what we do and what we say as well. So your being here is fantastic. Your willingness to take a vaccine such as this is fantastic because it's the right thing to do. It really is. COVID has flattened everything. My goodness. When this hit back in February, remember the good old days? Back in February when we thought things were okay, but then COVID hit and then we were being affected. Okay. We looked around and a lot of our partners were closing their doors. We couldn't move forward, and rightfully so, because this was a disease that we didn't know how to cure. We didn't know how to control. We didn't know how to test properly. We didn't know how to manage it. So a lot of our partners were closing and pushing people away. And under our amazing leadership, Miss Williams said, Steve, our community depends on us. If we close our doors, if we aren't able to reach them, if we aren't able to treat them, they're going to be in a worse situation because of that. So Ms. Williams and the team devised a way for us to remain open, continue to have patients come in under very safe conditions, of course, and we were able to maintain our patients who needed the help and who couldn't get it. So I appreciate Ms. Williams for her thought about that. It was a lot of hard work, continues to be a lot of hard work as well. But we're here to do the hard work because we're very privileged. We have the opportunity to help take care of our community. And I think that's what this is all about. We always talk about the providers, the nurses, our assistants, doing the incredible work of helping to heal our patients. And we also have to thank you for healing our patients, the community, when they're not in the clinic. So thank you for doing that. So today, we have a vaccine that we're all hoping is going to help control this COVID-19. Ms. Williams mentioned that I had a personal story to tell, and I'll keep it very brief. But there are a couple of us in this room who unfortunately have been infected with COVID-19. And it's good to see that we're all here to talk about it. Yes, Reverend Mahomey. Well, I had COVID-19, I was infected back in April. Okay, and it was a tough road back then. I was actually hospitalized for about 2 weeks in the intensive care unit. You know those nightmares you see on TV of the patients in the intensive care and it's looking gloomy? That was me. That was me. So, with the great prayers and support, I was able to endure. Of course, the fantastic medical staff, they literally saved my life. Experimental medications, because remember, COVID-19, there is no cure. And certainly back in April, we really didn't know what we were doing, so they hit me with some experimental medications. I remember the day that the infectious disease specialist came up to me while I was lying in bed. It was probably day 11 or 12. He said, Steve, things aren't looking so good. He could tell me the real deal because he knew I was a physician. He said, Steve, things aren't looking real good. You're spiraling the drain. I remember he did that. And fortunately, we were able to speak medical ease. We were able to speak in medical terms, so we understood each other without going through all of the layers of emotions and I'm scared and oh my God, my kids and all. No. We were able to get right to it He said, Steve, honestly, there's nothing out there that's going to take care of this for you. So, in about an hour, we're either going to intubate you, which is a procedure, they put a tube in your throat and they breathe for you the respirator, okay? You never know how long you're gonna be on the respirator. Hopefully it's just a short period of time. So the ID doc said, you're either going to have to go on the ventilator in about an hour because you're spiraling down, or we can try a medication. Really hasn't been used in anyone with COVID-19, but we can certainly try it. It's called tocilizumab. I'll never forget that name. I can't even spell it, but I'll never forget the name. Well, it is an approved medication for people with arthritis, severe arthritis. So what does this tocilizumab do? It basically shuts down your immune system. Because what was killing me, well, it was spawned on by the COVID-19, but what was killing me was my own immune system was mounting such a severe response to the COVID-19. So I was killing myself. So we had to shut the switch off or put a tube down my throat. So speaking in medicalese, I said to the ID doc, I said, listen, man, give me that medication. Let's see what it's going to do, all right? Blind faith. I knew that if I didn't try that, if I didn't do that, then for certain I was headed for a respirator, and who knows after that, okay? Don't confuse this with thinking if you go on a respirator, a ventilator, that it's over. No. What I'm saying was, we knew what the respirator could do. We didn't know what this medication could do. But I said, Doc, let's give it a shot. And that's exactly what he did. The incredible nurses came in, they put the IV in my arm, they put the bag up on the stand, it started dripping in, and before this I had a fever they couldn't control, I couldn't stand, my vision was going, I could barely even breathe, okay? I was really spiraling. That medicine, about an hour into that medicine, I started feeling better. Another hour or two later, fully went in, fever went away, vision was kind of coming back. I started to feel better. So 3 days later, I was able to go home, okay? My 61st birthday was spent in the intensive care unit, but I went home 3 days later. So I had COVID-19 again in November, and it wasn't as dramatic. It was kind of a piece of cake for me, and but I was in the hospital again for another 3 days, but not quite as bad. So the point that I'm trying to make is, yeah, I was sick with it. I came through. I took a leap of faith. I took that medication. It saved my life. So what are we asking you to do here today? We're asking you to take a vaccination that is brand new. Maybe we need to take that leap of faith, because if we don't get vaccinated, what's the alternative? The alternative is we're likely going to get COVID-19 and all that implies. So I just want to thank you all for being who you are, setting the example, being role models for our community, and taking the leap of faith with us all. This is going to help us and help our communities. And so I'll end with that, and thank you. Okay.
Thank you. Thank you, Pastor Wright. I told you guys this is a faith ministry. Yeah. So now what we'll do is we'll do the actual vaccination, and we're doing two videos, educational videos. We'll do the vaccinations will be the B-roll, what will be in the background, and then we'll be taping a 60-second video, two videos, one with Pastor Bell and Reverend Culpepper, and another one with Reverend Mahoney and Reverend Dr. Bishop Green. So that way, it's good to see differences, different age groups, different, it really resonates. So again, thank you for being our role models. All of you have, all of the speakers have mentioned this, and I wanted to just pause and say that as much as I'm the face most times, and I'm the person people hear from, the visionary, the leader, we have the best 310 caregivers at Whittier. And the people, this was the year of the nurses. My older sister is a nurse. She's a nurse midwife. And so I have a special place in my heart for nurses, but this was the year of the nurses. They were out there on the front lines doing those 40,000 tests, being here when we said we have to be open. And so we are just so deeply grateful to them. Samantha, who will be gentle when she administers the vaccination. You should see me in the noodle. I'm like, oh. And Jennifer, and the beauty of Jennifer is she grew up at Whittier. She was in our youth program, and now she's a senior nurse bossing all of us around. So I'd like to, and that's what we do. So I'd like to invite Jennifer and Samantha so they can explain to you quickly what will be done, and the fact that once you get the vaccination, you sit for 15 minutes, so if there are any issues, we can take care of it. There's a doctor in the house. Thank you.
There are several doctors in the house.
I'm a medical doctor.
Okay, so everyone, a couple of different things. You're gonna get 2 sheets of paper. One of them is the information about the Moderna vaccine itself. It has the who should get it, who should not get it, all the ingredients, when it was created, basically down to the T of what vial it goes into. The paper that's attached to it has the similar common side effects that you all might experience. So it's the same thing that's also in the first packet. It just has the V-Safe information, which is attached with the CDC. So if you are to experience any side effects outside of the normal that's listed, you want to report it right to the CDC because they're keeping track of all of that. You're also today going to get a card, each of you, with your name on it, as well as the date for your second dose. So Moderna, you get 2 doses, one today and then one in 28 days, which will be on the 19th of February. So we got to see your beautiful faces again, okay? It also on the front, it has that it's Moderna, the lot number, and then today's date, and then that you got it at Whittier. You want to keep this card. It's your basically get out of jail free, right? So most likely they're going to start converting this too also into like a little app so you can keep it around and let people know you've been vaccinated. But for now, I just ask that you keep this card with you at all times, okay? So we'll just ask for the name after that.
The vaccine is actually kept in the fridge because of, like Dr. Wright and like Ms. Frederica had said and stated, this is all very new and it's not like other vaccines. So this one we have to keep in the fridge until we're ready to administer. So right now we did set up, but the vaccine is located in the fridge. So once we have the people set up that we are going to vaccinate, Sam will go get those vaccines and we will be able to administer them to you. And like she said, we'll just have you sit so we can watch you to make sure that you're okay and don't have a reaction.
Yep.
And also, they will take your demographic information and your phone number. Immediately after you get the vaccination, you'll receive a text message for the scheduled date.
For the next
And
week.
then you will also receive reminders, because we have to keep a database of the testing and making sure that we get you back. So we
Yeah.
have your information and your home address.
So some common side effects, I do want to go over that really briefly. You will have some arm discomfort. It's kind of like getting the flu shot on like 10, right? So tomorrow, you'll more than likely start feeling like, wow, my arm is really super duper sore. That's been like the common thing as of right now. You might also experience, some tiredness. You might experience some, not fever really, but with the second dose, they're saying that once you get the second dose, you may see more of the symptoms show up. So just be cautious, pay attention to yourself. It's not gonna be like, oh my gosh, I can't even move, I'm so tired. But you might experience some things. So you just wanna pay attention to yourself, what's your normal, what's not normal for you. Okay, do you guys have any questions? No?
No.
All right, let me go get it.
Now do this one over here first.
There's no crying in medicine today. No.
Do you mind holding up your sleeve real quick? Just right here. Just hold that. Yep.
They make it look so easy on TV, don't they?
Alrighty. Oh, you wanna wait? Try to relax your arms. Nice and slow. Just like that. Ready? Take a deep breath. 1, 2, 3.
Wow.
Did it hurt?
No, no, didn't feel it. Oh, you gotta hit it again? Oh, okay. That's it? That's it.
We're all set?
All right, hey, we
Can
did it.
you take still pictures of the program?